It was a doctor at the VA hospital in Phoenix that sounded the alarm and brought the world's attention to the neglect facing our heroes at the hands of their very own government. The main whistleblower in that scandal, Dr. Sam Foote, joins me now. Dr. Foote, thanks for coming on the show tonight. Appreciate your time. Will that meeting make a change for veterans, do you believe?
Well, thanks for having me, Gerri. And I'd like to set you straight on the numbers. There were actually 9,000 to 10,000 veterans who were caught up in this scandal. 5,000 plus were never seen at the VA. And I had originally alleged that up to 40 patients may have died while waiting for care off of two lists that I was looking at. The actual number off of those two lists that died was 83. The total number of veterans who died at the Phoenix VA, in the Phoenix area while waiting for care at the Phoenix VA was 293.
Wow. Well, you know how this works, Dr. Foote. The administration says, how can you say they died from not getting care? They died from whatever their disease was. What's your response to that?
Well, that's correct. The cause of death is never a delay in care. The cause of death is cancer or coronary artery disease. The delay, in many cases, we feel strongly the delay contributed to the demise, especially in a couple of the coronary artery cases. But again, that's just semantics, and the numbers that were released in the IG report, nowhere will you see the 293 unless you take extensive time, read it 5 times, and add them all up.
It's unbelievable to me. Do you think any of the reforms that have been put in place are actually working at this point?
Well, I think Secretary McDonald got it right with downsizing the vision system. There were 22, and he's going down to 5. Give him strong marks for that. And we're very fortunate in Phoenix right now. Our current director, Glenn Griffin, is working very hard. But you have to understand, he's got many of the same people who caused this crisis, who have a vested interest in not necessarily being fully candid with him, in a situation that he has to sort out what's going on and take care of. And I've got to applaud him for his efforts in helping to settle many of the cases of veterans and employees who had been harmed by this. Yes.
Doctor, I just have to ask you, listening to you talk about this and the changes that are taking place, I think we failed to say you were working in Arizona. You were working at that facility. You're retired now. You're very familiar with it. What made you put up your hand and say, I've got to talk about this problem publicly?
Well, it kind of snowballed on us. We first figured out that they were lying because they were saying the waiting time was under 2 months and dropping to 30 days, when in asking the patients, they all said we've been waiting 3, 6, 9, 12, occasionally 15 months. And when we realized that people were actually dying off this list, we realized that people were being hurt, veterans were being injured, and it was time to say something.
And are you satisfied with the changes that have been made? Do you think the work is done?
And the work is not done. I would say that they've started to make a dent in it, but how hard they're trying and how vigorous their efforts are to really rid the system of, as Dan would say, the bad apples. In Sharon Hellman's case, they had a slew of evidence that they did not use, and they were fortunate that they were able to find the inappropriate taking of money from outside vendors to terminate her on.
Sam, thanks for coming on the show.
Thanks for having me.